So hello students. Now let us understand two interrelated topics. These are also important from the exam point of view. The pharynx and the larynx, they go hand in hand. So just try to understand the pharynx and the larynx simultaneously. Okay. Now we've got two types of muscles on the pharynx. One muscle which goes like this, like this, like this. And when these muscles contract, they reduce the lumen. They reduce the lumen. We call these muscles as the constrictors. Constrictors. So there are three constrictor muscles of the pharynx. One is the superior constrictor, one is the middle constrictor, one is the inferior constrictor. Okay, these are the circular muscles, also known as constrictor muscles. The second group of muscles of the pharynx are the longitudinal muscles. Longitudinal muscles. Now, let us first understand the circular muscles, where these muscles begin from, where they go, how the pharynx is formed, what are the parts of the pharynx, the oropharynx, the nasopharynx, the laryngopharynx, and how is the pharynx related to the larynx. Okay, so students, have a look at this. Let me begin with this. I'll draw a slide for you. Now, we have seen the sphenoid bone. You remember the sphenoid bone? Who lies in that sphenoid bone? There's a fossa known as sella turcica or the pituitary fossa. The pituitary gland lies in there. That's inside the skull. Now the same sphenoid, the body of the sphenoid, when we see from the base of the skull, that's how the body of the sphenoid looks. Okay, here, so this is from inside the skull, and that's a pituitary gland here. That's from inside the skull. The base of the skull here, the body of the sphenoid shows a tubercle here. Tubercle. What is this tubercle? Known as the pharyngeal tubercle. And from this pharyngeal tubercle, we draw a straight line down here. This is what we call as the median raphe. Median raphe or the pharyngeal raphe. So from the base of the skull, we are looking the body of the sphenoid. There's a tubercle named the pharyngeal tubercle. We draw a straight line from there. That's the median raphe or the pharyngeal raphe. Now, the muscles of the pharynx would begin from front, I'll tell you, and they get inserted into this pharyngeal raphe. Let us understand these muscles. Okay, tell me now, students, what is this bone here? What is this bone here? That's the hyoid bone, hyoid. What is this cartilage here? Below the hyoid bone, that's a thyroid cartilage, thyroid cartilage. And what is this cartilage? Below the thyroid, it's a C-shaped cartilage. I've told you this in the previous lecture. That's a cricoid cartilage. So that's the hyoid bone. That's a thyroid cartilage. That's a cricoid cartilage. Okay, this is the cricoid cartilage. Just below the cricoid cartilage, we get two separate tubes. Below the cricoid cartilage, we get two separate tubes. What is the level of cricoid cartilage? C6. C6, right? So below C6, this becomes the, yes, what is that? Esophagus. This becomes the esophagus, and this becomes the trachea. Below C6, there are two separate tubes. The one in front is the trachea, the one behind is the esophagus. Above C6, this one is going to be the pharynx, and in front of the pharynx is going to be the larynx. So let us make this pharynx and larynx, students. Now, there's a muscle of the pharynx. Understand this. There's a muscle of the pharynx which begins from the hyoid bone. This muscle begins from the hyoid bone. Now, hyoid bone is like this, correct? Half will lie on this side and half will lie on this side. So that's part of hyoid bone. That's part of hyoid bone. When we're looking from the side, you'll see only this part. So I've drawn it like that. A muscle begins from the hyoid bone. A muscle comes back like this, like this, like this, and gets inserted into this median raphe. So one part of the muscle will go from here. The other half of muscle will go from that side. Are you able to follow this? The other half will go from that side, and that's how you get a tube-like structure. What is this muscle of the pharynx known as? That's the middle constrictor. This is what we call as the middle constrictor. Middle constrictor muscle of the pharynx. Now, there's a muscle which begins from the thyroid and the cricoid cartilage. There's a muscle which begins from the thyroid and the cricoid cartilage like this. So half muscle will come from here, half will go from that side. You can understand now how that tube is formed. And what is this muscle which begins from the thyroid and the cricoid, known as inferior constrictor, right? That's the inferior constrictor. The one which begins from the thyroid is known as the thyropharyngeus part. Thyropharyngeus part of inferior constrictor. The one which begins from the cricoid is known as a cricoid Cricopharyngeus part of inferior constrictor. Inferior constrictor has got two parts: Thyropharyngeus part, which begins from the thyroid cartilage; Cricopharyngeus, which begins from the cricoid cartilage. Right, so half muscle comes from here, half comes from here, and they interdigitate in this median raphe. That's how a tube is going to be formed, and when this muscle contracts, the lumen is going to be reduced. These muscles are therefore known as constrictors, or this is what we call as the circular muscle of the pharynx, circular muscle. Now coming to the topmost muscle, the superior constrictor. Where does the superior constrictor begin from? Let me just draw this for you. That's the medial pterygoid plate. It has gone very high up. That's a medial pterygoid plate. Okay, I'll just clear this. Fine, that's a medial pterygoid plate. This is the mandible here. Sorry, that's the mandible here. Mandible. So medial pterygoid plate, you know, lateral pterygoid plate, which was giving origin to the lateral pterygoid and the medial pterygoid. Lateral pterygoid plate ka lateral aspect gives origin to lateral pterygoid. Medial aspect gives origin to the deep head of medial pterygoid. Fine. Okay, so that's the medial pterygoid plate. Deep inside to the lateral is medial pterygoid plate. That's a medial pterygoid plate. There's a hook here. The medial pterygoid plate has got a hook like this. Name the pterygoid hamulus. Pterygoid hamulus. So the medial pterygoid plate, the pterygoid hamulus, there's a raphe here which begins from the pterygoid hamulus to the mandible. We call this as the pterygomandibular raphe. Pterygomandibular raphe. So medial pterygoid plate, pterygoid hamulus, pterygomandibular raphe, and the mandible, right? All this will give origin to a muscle here. All this is going to give origin to a muscle like this, and this muscle is what we call as the superior constrictor. Superior constrictor muscle of the pharynx. This is the superior constrictor. That's the middle constrictor, and this is going to be the inferior constrictor. Are you getting this, students? Are you able to follow this? Once again, I'll just tell you. This should be slightly in front, so the length would be the same. Okay. So the superior constrictor begins from the medial pterygoid plate, the pterygoid hamulus. This is a hook, pterygoid hamulus. This raphe is the pterygomandibular raphe. Students, this is the raphe which you feel while giving an injection. Okay, while anesthetizing the inferior alveolar nerve. We give anesthesia in the vicinity of the inferior alveolar nerve. For that, when you put your finger inside the mouth, you feel for the thickened raphe. Yes, that's the pterygomandibular raphe. Very good, which you're feeling here. And that's the mandible. So all this will give origin to the superior constrictor muscle. The middle constrictor begins from the hyoid bone. Inferior begins from thyroid and cricoid cartilage. Now the muscle comes like this, the muscle comes like this, and they interdigitate here. And this is a tube that we get. That's the pharynx. Are you able to follow this? That's the pharynx. Have a look at the slide, students. Beautiful slide. Look, this is awesome. So that's the medial pterygoid plate deep inside this. This is lateral. Deep to that is going to be the medial pterygoid plate. This is the pterygoid hamulus. What is this? This is the pterygomandibular raphe. Now students, this pterygomandibular raphe is very important because this gives origin to two muscles. The muscle behind, what is this muscle behind? This is the superior constrictor. And the muscle in front of the pterygomandibular raphe, this is the buccinator. A very, very important MCQ for you students. The pterygomandibular raphe, which begins from the pterygoid plate, from the pterygoid hamulus to the mandible, gives origin to two muscles. The muscle in front is the whistling muscle, buccinator. The muscle behind is the superior constrictor. Am I clear? Are you able to follow this? That's a superior constrictor. So this is the superior constrictor. What is this bone, students? What is this bone? That's the hyoid. So what is this muscle going to be? That's the middle constrictor. Now that's the thyroid and that's the cricoid. So this is the thyropharyngeus part and the cricopharyngeus part of inferior constrictor. Clear with this, all of you? Now look at this slide. What is this slide? This is a view from backside. You're looking from backside. What is this line? That's the sphenoid bone. This is the sphenoid bone which I had drawn. What is this? This is the median raphe or the pharyngeal raphe. What is this muscle? That's the superior constrictor. That's the middle constrictor. That's the inferior constrictor. Clear to all of you? And clear now how the tube known as pharynx is formed. I hope this is clear. Now understand one thing, students. That's the superior constrictor. That's the middle constrictor. That's the inferior constrictor. Or you see from side, this is the superior constrictor, that's the middle constrictor, that's the inferior constrictor. No, 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 no. They're not like this. They're not like this. They're not placed edge to edge, superior, middle, inferior. No, they're not placed edge to edge. They overlap each other. They overlap. That means the superior constrictor is overlapped by middle constrictor, and the middle constrictor is overlapped by inferior constrictor. Like you place one cup inside the other. Like one cup you place within the other cup, you place within the other cup, how they are going to overlap each other. Are you able to follow this? Look at the slide. Look at this slide. Like this is one glass. We place this glass within the other glass. So this is going to overlap here. We place this within the other. So this is going to overlap here. You're following this? Similarly, other constrictors. So what is this constrictor going to be? That's the superior constrictor. And you can see how the middle constrictor is going to overlap the superior constrictor and how the inferior constrictor is going to overlap the middle constrictor. Are you following this? So when they overlap each other, there is a space between them. Look, there's a gap here. There's a gap between the superior and the middle constrictor. There's a gap between the middle and the inferior constrictor. And through this gap, now what is this tube? That's the pharynx, right? That's the pharynx. And if any structure from outside the pharynx, now this is going to be the outside of the pharynx. If any structure from outside, if it has to go inside the pharynx, how will it enter the pharynx, students? Through the gaps between the constrictors. It passes through the gap between the constrictors, right? So between the superior middle, between the middle inferior and below the inferior constrictor, the structures pass through the gap between the constrictors. Now have a look. What is this, students? That's the superior constrictor. That's the base of the skull, right? Between the superior constrictor and the base of the skull, there is a fascia here. Between the superior constrictor and the base of the skull, there is a fascia, and this fascia is known as the Pharyngobasilar Fascia. Pharyngobasilar Fascia. So between the base of the skull and the superior constrictor lies a fascia. That's the Pharyngobasilar Fascia. So there are certain structures which will pierce this Pharyngobasilar Fascia and they will enter the pharynx. So there will be structures which go above the superior constrictor. There will be structures which go between the superior and the middle, between the middle and inferior, and below the inferior constrictor. That's how the structure would enter inside the pharynx. Am I clear, students? Am I clear to all of you? Are you able to follow this? The constrictor muscles are clear. Where they begin from, where they insert. What is this known as? What is this line known as? The median raphe. That's a median raphe. That's a line drawn from the base of the skull. The muscle gets inserted into this median raphe from both the sides, and that's how the tube pharynx is formed. Any structure entering the pharynx from outside would pass between the constrictors. Now, this is something, a very important MCQ that we get here. What are the structures which pass between the pharynx, between the constrictor? One moment. So let me just write this down for you. Structures passing between, I'll just mention this for you. Structures passing between the superior constrictor, structures passing between the superior constrictor and the base of skull. Base of skull. Structures passing between the superior constrictor and the base of the skull, or you say structures passing above the superior constrictor. That's also fine. Structures passing above the superior constrictor, meaning the superior constrictor and the base of the skull. This gap between the superior constrictor and the base of the skull is known as the sinus of Morgagni. Sinus of Morgagni. So what is sinus of Morgagni? That's a space between the superior constrictor and the base of the skull, and this gap is closed by the Pharyngobasilar Fascia. Pharyngobasilar Fascia. Clear? So what are the structures passing here? Number one is the auditory tube. Number one is the auditory tube. Second, yes, one is the auditory tube. Anything else? A muscle of the soft palate that is known as tensor palatii. Tensor palatii. Just remember this, this is what is asked in the MCQ. Structures which go between the constrictors. So one is the eustachian tube which goes above the superior constrictor. Second is the tensor palatii muscle. That's a muscle of the soft palate. Third is the ascending palatine artery. Ascending palatine artery. Students, can you tell me this is a branch of what? Ascending palatine. Have we not seen this, students? We have seen this right in the first lecture. Ascending palatine artery is a branch of facial. Excellent. Very nice. Huh? Very nice. You're answering very well. It's a branch of facial artery. Very good. And fourth is the palatine branches of ascending pharyngeal artery. Palatine branches of ascending pharyngeal artery. Just remember this four structures, very important from MCQ point of view. Eustachian tube, the tensor palati muscle, the ascending palatine artery, and the palatine branches of ascending pharyngeal artery. Now, this ascending pharyngeal artery is a branch of external carotid. External carotid, uska palatine branch. Its palatine branch. So, clear structures passing between the superior constrictor and the base of the skull. Now, coming to the next one, structures passing between the superior constrictor and middle constrictor. Superior and middle constrictor. So what are the structures which pass between the superior and the middle constrictor? One is the glossopharyngeal nerve. Glossopharyngeal nerve, and the muscle which the glossopharyngeal nerve supplies, the ninth cranial nerve. Which is that muscle, students? Come on. That's the stylopharyngeus. Stylopharyngeus muscle. Stylopharyngeus muscle. And this stylopharyngeus muscle is a muscle of the third pharyngeal arch. You remember, students, glossopharyngeal nerve supplies the muscle of third pharyngeal arch. To supply this muscle of the third pharyngeal arch, what is the component which the glossopharyngeal nerve should have in its nucleus? Can you tell me this? We've seen this. So what is the component of, what is the functional component to be present in the nucleus of glossopharyngeal nerve? That's the special visceral efferent. Special visceral efferent. Very good. And what is the name of the nucleus of glossopharyngeal nerve to supply the stylopharyngeus muscle? The nucleus ambiguous. Wow, superb. That's nucleus ambiguous. Excellent. Very good. You're very well versed now. Good. That's the nucleus ambiguous, right? So structures passing between, that's between the superior and middle constrictor. Now coming to the next one, structures passing between the middle and inferior constrictor. Between middle and inferior constrictor. Between the middle and inferior constrictor. That's the third. And fourth is below the inferior constrictor. Below inferior constrictor, right? Fine. So now, between the superior and the middle, between the middle and the inferior constrictor, what passes? You know, the vagus, the nerve supply of the larynx we'll be discussing later, but I'll just tell you this directly. Later on, we'll see the nerve supply of larynx. So what passes between the middle and inferior constrictor is the internal laryngeal nerve, internal laryngeal nerve, internal laryngeal nerve, and the superior laryngeal vessels. Superior laryngeal vessels. Now, you know what? This larynx, we are studying the pharynx. The larynx is lying in front of the pharynx. I'll tell you this later. So larynx is lying in front of the pharynx, and what is the nerve supply of the larynx above the vocal folds? That's the internal laryngeal nerve. Now, this internal laryngeal nerve has to go to the larynx. So it passes between the two constrictor muscles of the pharynx. Yes, it goes inside the larynx. It supplies the sensory supply of the larynx above the vocal folds. And there's another nerve which is going to supply the sensory supply to the larynx below the vocal folds. That's the recurrent laryngeal nerve. And this recurrent laryngeal nerve will pass below the inferior constrictors, right? So what passes below the inferior constrictor is the recurrent laryngeal nerve, and inferior laryngeal vessels. Inferior laryngeal vessels. Okay, recurrent laryngeal nerve and inferior laryngeal vessels. Fine, students, just remember this. This is extremely important. Now, how it goes, that I'll tell you later. Fine, students, this is clear. Right. Now, I'll draw a slide for you. I'll draw a slide for you. Just try to understand the slide. Right. I'll draw a slide for you. Have a look at this. Now, we're taking a section. Sagittal section of the face. Now, I don't draw the eye here. No, we don't draw the eye. Why? Because we're taking a section. So, we're looking from inside. Sagittal section. That's the base of the skull here. That's a pharyngeal tubercle. What is that? Median raphe. That's a median raphe. Clear? Okay, just come here now. Okay, now tell me, what is this bone? Hyoid bone. I'll draw it slightly higher. That's a hyoid bone. That's a thyroid cartilage. That's a cricoid cartilage. Now, what is this tube below the cricoid cartilage? This is the trachea. And what is this? Esophagus. That's the esophagus. What is this level? C6. That's C6, right? That's the base of the skull here. Base of the skull. What is this? What is this, That's a hard palate. And what is this going to be? The soft palate. So that's a hard palate. That's a soft palate. Now, beginning from the hyoid bone is this. What is this? Tongue. That's a tongue. What are these two folds here, which begins from the soft palate and goes to the tongue, and who's lying here? That's the palatine tonsil. So this is the palatoglossus, that's the palatopharyngeus. Okay, that's the palatoglossus, palatopharyngeus, and what lies between the palatoglossus and palatopharyngeus is the palatine tonsil. Right, I'll just draw this slide on this side so it will be easy for you to understand. Have a look at this. Tell me, students, what is this going to be? The hyoid bone, that's the hyoid, right? What is this? That's the thyroid. That's a cricoid. That's a cricoid, right? Hyoid, thyroid, cricoid. Just one moment. Fine. Now, what is this? That's the trachea, right? What is this which begins from the thyroid? That's the epiglottis. That's the epiglottis. Okay, the one which begins from the thyroid is the epiglottis. Okay, that's the epiglottis. Fine. What is this sitting on the cricoid? These are the arytenoid cartilage. Arytenoid, this I'll tell you in larynx. These are the aryepiglottic folds. Aryepiglottic folds. So what is this structure that I've drawn? This is the thyroid. This structure is the epiglottis. These are the aryepiglottic folds. These are the arytenoid cartilage. That's the cricoid. So this structure is the larynx. That's the larynx. Now this larynx, we have to place it here. The same thing I'm trying to draw the larynx. Have a look. So what is this structure from the thyroid going back to the behind the tongue? That's the epiglottis. What is this structure which is sitting on the cricoid cartilage? These are the arytenoids. And what are these folds here beginning from the epiglottis to the arytenoid? These are the aryepiglottic folds. Aryepiglottic folds. So that's the larynx. This is the larynx. So now, this is the nose, lateral wall of nose, and these are the conchi. That's the lateral wall of nose. These are the conchi. So now the pharynx, students, we've taken a section. The pharynx extends from the base of the skull to C6. Pharynx extends from the base of the skull to C6. The pharynx is made up of three parts. This part is behind the nose. That's the nose. So this part of the pharynx behind the nose is known as nasopharynx. Nasopharynx. This part of the pharynx behind the mouth is known as what? Oropharynx. And this part of the pharynx behind the larynx is known as the laryngopharynx, or it is also known as the hypopharynx. Hypopharynx. I'll just make a defining line. So this much part. So look, this much part is what? This much part is going to be the nasopharynx. That's the oropharynx, and that is going to be the laryngopharynx. Laryngopharynx. Clear? So these are the various parts of the pharynx. We have taken a section. We have taken a sagittal section. Clear to all of you? Okay. So this is the nasopharynx, oropharynx, laryngopharynx. Now, what do we get in the nasopharynx, students? We get in the nasopharynx, we get a tube here. What is this tube known as? The eustachian tube. Eustachian tube. This eustachian tube was going above the superior constrictor. And it opens in the nasopharynx. From the eustachian tube, we get a muscle here. What is this muscle known as? This muscle is known as the Salpingopharyngeus. Salpingopharyngeus. From the eustachian tube, the muscle is known as the salpingopharyngeus. What is this muscle which begins from the palate? What is this muscle known as? Palatopharyngeus. Palatopharyngeus, right? So these are the longitudinal muscles of the pharynx. We have studied the circular muscles, the superior, the middle, and the inferior constrictor. Clear? Now this is a section and these muscles are inside. Above the eustachian tube, what is that? Salpingopharyngeus. From the palate to the pharynx, that's the palatopharyngeus. And thus one muscle which begins from outside the pharynx, the styloid process. The styloid process gives origin to a muscle of the pharynx, that's the stylopharyngeus. Students, the stylopharyngeus is outside the pharynx. Now this stylopharyngeus has to go inside the pharynx. This stylopharyngeus from outside has to go inside the pharynx. How does it enter the pharynx? Between the superior and the middle constrictors. We have seen this. So the stylopharyngeus enters the pharynx between the superior and the middle constrictors. Find its friends. Oh, where are my friend? So these two friends are there, the salpingopharyngeus and the palatopharyngeus. They will join with stylopharyngeus and all these three will get inserted here on the posterior border of the lamina of thyroid cartilage. Posterior border of the lamina of thyroid cartilage. So that muscle is stylopharyngeus. I'll show a slide to you. I'll show a slide. Have a look at this slide. Look at this slide. What have we done here? We've cut this. Okay, see this slide first. See this slide. So if you join this behind, you'll get that line. That's the meat and Raphe. So we've cut the meat and Raphe. We have opened the circular muscles of the pharynx. That's the superior constrictor. That's the middle constrictor. That's the inferior constrictor. We have opened the muscles of the pharynx and now we are inside the pharynx. Now this is the nose. So this part of the pharynx behind the nose is going to be nasopharynx. That's a tongue. So that's the mouth. So this part of the pharynx behind the oropharynx is going to be, behind the oral cavity is going to be the oropharynx. Now that's the epiglottis. These are the aryepiglottic folds. So that's the larynx. That's the larynx. And this part of the pharynx behind the larynx is the laryngopharynx. Are you able to follow this, students? If I close this, I get the oropharynx, nasopharynx, oropharynx, and the laryngopharynx. What we have done is we have cut the meat and Raphe, we have opened the circular muscles, and we're looking inside. Look at this slide. What is this muscle? If I join this, this we have cut, the meat and Raphe. That's the meat and Raphe. We have cut, we have opened this. So what's that? Superior constrictor. Here we have opened. That's the middle constrictor. We have opened. And that's the inferior constrictor. Okay, we have opened this. Now we are looking inside the pharynx, right? That's the nasopharynx here. That's the oropharynx. That's the laryngopharynx. You can see the larynx here. What is this now? Eustachian tube. That's the eustachian tube. And students, see a muscle which is coming from the eustachian tube. What's that? Salpingopharyngeus. Very good. This is a soft palate. There's a muscle coming from the soft palate. That's the palatopharyngeus. And look, what is this now, students? That's the styloid process. And what is this muscle? Stylopharyngeus. Now, this stylopharyngeus has to go inside the pharynx. It is passing between the superior and the middle constrictor. It enters inside the pharynx. Look at this muscle. Look at this muscle. That's the stylopharyngeus. Now, clear? So, stylopharyngeus has come between the superior and inferior constrictor. It is going inside. Here it has come inside. Now, these three muscles will get inserted into the thyroid cartilage. I hope I'm clear to all of you. So, what is this about the superior constrictor? That's a gap here which is closed by a fascia. What is this fascia? Pharyngobasilar fascia. You're clear, students? What are the structures passing above the superior constrictor, between the superior middle, between the middle inferior, and below the inferior constrictor? How the structure enters the pharynx? Perfect. Okay. Very good. Very good. Excellent. Excellent. Excellent to all of you. Okay. Just let me tell you one thing. We'll just write this. Nerve supply is very important. So I'll just write the pharynx here. I'll write the muscles of the pharynx. One is the circular muscles and the longitudinal muscles. Circular and longitudinal, right? Circular muscles are known as constrictor. So what you have first here, superior constrictor, middle constrictor, third is inferior constrictor, two parts, thyropharyngeus part, cricopharyngeus part. Clear? So superior, middle, inferior constrictor का thyropharyngeus part, cricopharyngeus part, longitudinal muscles, salpingopharyngeus, I'll just write in short, palatopharyngeus, and third is stylopharyngeus. What is the nerve supply of all this? The nerve supply of the longitudinal muscle is pharyngeal plexus, except pharyngeal plexus, except the stylopharyngeus, stylopharyngeus, which is supplied by glossopharyngeal nerve. Just remember this, students, that's a very important MCQ. What is the nerve supply of the longitudinal muscle of the pharynx? It is supplied by the pharyngeal plexus, except the stylopharyngeus, which is supplied by glossopharyngeal nerve. And what about the circular muscles of the pharynx? What is the nerve supply of the circular muscle? Again, the pharyngeal plexus. Pharyngeal plexus. What is pharyngeal plexus? I'll tell you. Except the cricopharyngeus part. Cricopharyngeus part of inferior constrictor. Cricopharyngeus part of inferior constrictor, which is supplied by external or recurrent laryngeal nerve. External or recurrent laryngeal nerve. So all the circular muscles, superior, middle, and the thyropharyngeus part of inferior constrictor, these are supplied by pharyngeal plexus, except the cricopharyngeus part of inferior constrictor, which is supplied by a different nerve, external or recurrent laryngeal nerve. Now students, just understand, look, 3 muscles are supplied by a single nerve, 1 muscle is supplied by a different nerve. So sometimes there's an incoordination, there's a neuromuscular incoordination. These 3 muscles contract together, this 1 muscle contracts separately. There's a gap between the muscles of the pharynx, and this is what we call as the Killian's dehiscence. So what is Killian's dehiscence? Because of difference in nerve supply, sometimes there's an incoordination and a gap is formed between the muscles of the pharynx. We call this as the Killian's dehiscence. Perfect. Clear to all of you? The nerve supply of the pharynx is clear to all of you? Now, looking at this slide, you tell me now, where is the larynx with respect to the pharynx? Where is the larynx with respect to the pharynx? Yes. Yes, very good. What have you said? The larynx is in front of the pharynx. That's fine. Larynx is in front of the pharynx. That's excellent. Anything else can you think? Where is the larynx with respect to the pharynx? Anything else can you think? Look, one moment, just have a look. What is this line? If we draw behind here, what is this line? That's a median raphe, right? That's a median raphe. Now, this is the larynx, and the muscles of the pharynx would begin from the larynx, begin from the cartilages of the larynx. Have a look at this. Now, what is this muscle which was beginning from the middle constrictor and going back like this? What is this muscle? Which was beginning from the hyoid. I'm so sorry. That's the middle constrictor muscle. Half comes from here, half goes from that side. So what is this muscle? Middle constrictor. What is this muscle which begins from the thyroid and cricoid? Half goes like this and half goes like that. What is that? Inferior constrictor. And what is this muscle up here? Superior constrictor. So now you tell me, where is the larynx gone? Students, the larynx is inside the pharynx. Are you able to follow this? The larynx is inside the pharynx, because the muscles of the pharynx would begin from the cartilages of the larynx. So the larynx goes right inside the pharynx. And that is why if you have to see the larynx, you have to first cut the pharynx, you have to open the pharynx, and what you see inside the pharynx is the larynx. I hope I'm able to clear this. Have a look at this. Look, what is this? This is the epiglottis, correct? These are the aryepiglottic folds. If I go inside this, where do I go? Inside the larynx. And what are these? These are the constrictor muscles. If I join them like this, where is the larynx gone? Inside the pharynx. The larynx is in front, the larynx is inside the pharynx. If I have to see the larynx, I have to cut the pharynx, I have to open the pharynx, and that's the larynx. So the nerves which are supplying the larynx, if they have to go to the larynx, they have to pass between the constrictors. They have to pass through the pharynx. Then they enter into the hypopharynx or the laryngopharynx, and from there they'll go into the larynx. This is exactly what the internal laryngeal nerve and the recurrent laryngeal nerve does, right? They go between the constrictors. Between the middle and inferior constrictor goes the internal laryngeal nerve, and below the inferior constrictor goes the recurrent laryngeal nerve. They enter the laryngopharynx and then they go to supply the larynx. So the larynx is within the pharynx in front of the hypopharynx or the laryngopharynx. I hope this is clear to all of you students. Huh? Look, that's again a section. That's again a section. That's the eustachian tube. So what is this muscle? What is this muscle? That's a salpingopharyngeus. That's a palate. So what is that? Palatopharyngeus. And look at this, stylopharyngeus. That's a stylopharyngeus. This is the pterygomandibular raphe. That's a pterygomandibular raphe here. So what is this muscle? That's a superior constrictor, and this is going to be the buccinator. In front of the raphe, buccinator, behind it is the superior constrictor. Perfect. Clear to all of you? Very nice. You've been answering very well. Students, answer this. Between the superior and the middle constrictor passes. Yes. Between the superior and middle constrictor passes the glossopharyngeal nerve and the stylopharyngeus muscle. External laryngeal nerve, no, it does not pass. Superior laryngeal nerve, it's the internal laryngeal branch of superior laryngeal. Fine, that's it. Coming to the next one. Okay, sinus of Morgagni. Sinus of Morgagni is between the base of the skull and the superior constrictor. Between the base of the skull and the superior constrictor is the sinus of Morgagni. What passes? That's the superior constrictor and base of skull. Clear? What passes from here? The eustachian tube, I'm so sorry. That's the levator palate. Yeah? It's not the tensor palate. Sorry, by mistake I written tensor palate. That's the levator palate. Okay, this is not tensor palate. I'm so sorry. Make it as levator palate. It's the levator palate, not the tensor palate. Levator, not the tensor. It's the levator. It's coming from above. It's elevating the palate. It's the levator palate. Fine. So what passes above the superior constrictor is the auditory tube, the levator palate muscle, the ascending palatine artery, and the palatine branches of ascending pharyngeal artery. Students, I hope this is clear to all of you. This topic of pharynx is clear, a complicated topic and worth understanding. A complicated, but yes, worth understanding. I hope you are clear with the larynx, with the pharynx, how the larynx is in front of the pharynx. We've understood the circular muscles of the pharynx, how they begin and how they get inserted into the meat and raphe, how there are gaps between the constrictors, how the structures pass between the constrictors to enter the pharynx or the larynx in front. We've seen the longitudinal muscles of the pharynx, the salpingopharyngeus, which begins from the eustachian tube in the oropharynx, the palatopharyngeus, which begins from the palate in the oropharynx, and the stylopharyngeus, which comes from the styloid process, enters between the superior and middle constrictor, comes inside the pharynx, joins with these two muscles, and together they are inserted on the posterior border of the lamina of thyroid cartilage. I told you the nerve supply, which is extremely important. Now, one more thing I'll tell you, what is pharyngeal plexus? Pharyngeal plexus, because you might get an MCQ on this. Okay, just one moment. What is pharyngeal plexus? Let me just tell you this also. Pharyngeal plexus is formed by... Now, this pharyngeal plexus is going to supply many things. So, you have to know this pharyngeal plexus. It is formed by the pharyngeal branch of... It's formed by the pharyngeal branch of glossopharyngeal nerve, pharyngeal branch of glossopharyngeal nerve, the pharyngeal branch of vagus, pharyngeal branch of the vagus with cranial accessory. See, the cranial accessory goes everywhere with the vagus. Wherever the vagus goes, the cranial accessory goes with the vagus. Spinal accessory is a different nerve. It supplies the sternocleidomastoid and the trapezius. Now, the third one is a branch from the superior cervical ganglion. Branch from the superior cervical ganglion. This is going to be the sympathetic. Sympathetic. This supplies the blood vessels. A branch from the superior cervical ganglion. So this is sympathetics. Now this pharyngeal plexus, where does it lie? This pharyngeal plexus lies on, yes, this pharyngeal plexus lies on middle constrictor muscle. That's a very important MCQ. It lies on the middle constrictor muscle of the pharynx. So how's the pharyngeal plexus formed? One, the pharyngeal branch of glossopharyngeal nerve, the pharyngeal branch of vagus with the cranial accessory, and a branch from superior cervical ganglion. Now, this pharyngeal plexus is lying on the middle constrictor muscle of the pharynx, and this pharyngeal plexus is going to supply the circular muscles of the pharynx, except the cricopharyngeus part of inferior constrictor, which is supplied by the external or the recurrent laryngeal nerve. It is going to supply the longitudinal muscles of the pharynx, except the stylopharyngeus, which is supplied by the glossopharyngeal nerve. Now, this pharyngeal plexus also supplies the muscles of soft palate. Students, can you tell me the muscles of soft palate? Here only I'll finish. One is the levator palati, muscle, which goes above the superior constrictor. The second one is the tensor palati muscle, which is going to tense the palate. There are two muscles which begins from the palate, one to the tongue, palate to the tongue, palatoglossus, palate to the pharynx, palatopharyngeus, and there's one muscle which hangs in the center when we do an that muscle which hangs in the center, that's the musculus uli. Okay, so which are the muscles of the soft palate? Let me just enumerate this for you. Soft palate. Which are the muscles here? One, levator palati. Second, tensor palati. Tensor villi palati, tensor palati, same. Then is palatoglossus. Next is palatopharyngeus. And the last one is musculus uli. So these are the 5 muscles of the soft palate. Levator palati, tensor palati, palatoglossus, palatopharyngeus, and the musculus uli, the thing which hangs in the center when we do an R. Now, all these muscles of the soft palate are supplied by the pharyngeal plexus. We have just seen this. Except, yes, students, can anyone tell me this? You are very bright students. You are excellent students. Come on, tell me. We have discussed this. All the muscles of soft palate are supplied by pharyngeal plexus, except, yes. Very good. What have you answered? Except the tensor palati. Except tensor palati, which is supplied by mandibular nerve, right? Mandibular nerve. That means tensor palati is derived from the first pharyngeal arch. It is supplied by the mandibular nerve, not the direct mandibular. It's through the nerve to medial pterygoid. Through the nerve to medial pterygoid. Remember, the nerve to medial pterygoid supplies the medial pterygoid, tensor palati, and tensor tympani. So all the muscles of soft palate are supplied by the pharyngeal plexus, except tensor palati, which is supplied by the mandibular nerve through the nerve to medial pterygoid. So this much you need to know about the soft palate also, students. Clear? This is about the soft palate that you need to know. Clear, students? So that's about the pharyngeal plexus. I've told you this lies on the middle constrictor muscle of the pharynx. I've also told you the soft palate, the muscles, the nerve supply of the soft palate. That much is what you remember and answer. Students, I hope this lecture is clear to all of you. Yes, in case of doubts, do get back to me. Thank you and happy learning till then. Thank you.